In September 2015, the global community adopted the 2030 Agenda for Sustainable Development, which comprises the 17 Sustainable Development Goals. SDG 3 on health and well-being is an ambitious vision to end major epidemics. It calls for universal health coverage and better access to medicines and vaccines. Every year, tens of millions of people die or suffer needlessly from these diseases simply because they are not able to access effective tests and treatments. Can we ensure that people receive the health services they need wherever they need them? Can we make health the right for all?
In the last decade or so, you've seen many product development partnerships come together, and rightly so, because there is a major innovation gap for many, not just neglected diseases, but for other diseases as well. So it's great that we have these PDPs, but the PDPs hit a wall. When they get to the stage where they develop a product, then the problems of actually getting these products to patients in need becomes a major issue.
To get the right health technologies to the right people and in the right places, there is a wide range of important decisions that governments need to make.
One of the big trends we're seeing in the next 15 years is around the economies in low and middle income countries are growing, and growing faster than those of, from a percentage point of view, from industrial countries. As those economies grow, the countries are graduating from traditional aid, that through domestic resources, both public and private, those countries are going to be financing more and more and more of their health needs. The result is that many of the innovations that used to be driven by donors who decided what were the important innovations, which ones were they going to finance, and which ones they would support for introduction to countries, is no longer going to be the decision of donors. It's going to be the decision of the governments themselves.
New medicines, diagnostics and vaccines for many of the diseases that affect low and middle income countries are often developed by product development partnerships, such as the Global Health Innovative Technology Fund. The Access and Delivery Partnership, or ADP, provides technical and capacity building support to countries to help ensure access to and delivery of those new health technologies. Led by the United Nations Development Programme and funded by the Government of Japan, the ADP is a collaboration between UNDP, the Special Programme for Research and Training in Tropical Diseases, and PATH. In Indonesia, the ADP is working with the National Agency of Drug and Food Control to build health sector capacity in implementing pharmacovigilance systems for monitoring the safety of newly introduced health technologies.
With the ADP project that last year we have done, that we learned about how to setting up an active pharmacovigilance. In the future, we will do more active surveillance. We will get more and more data safety from the field. And in terms of that, I think our pharmacovigilance unit or pharmacovigilance centers in our agency need to strengthen our capacity on risk assessment.
In Ghana, the ADP partners with the Ministry of Health to support the effective implementation of the National Medicines Policy, which represents the government's commitment to universal health coverage.
One of the things I like about the approach is that within one country, the ADP approach is trying to bring different institutions and different issues together. So within Ghana, we have the capacity building component. We have the component where we are looking at pharmacovigilance. We have the aspect where we are looking at medicines and drugs, which are all critical areas that need to be addressed.
In Tanzania, the ADP is working with the Ministry of Health on strengthening evidence-based priority setting for the cost-effective selection of new health technologies.
Important issues are introduction of new health technologies. The ADP project is now introducing a health technology assessment, which will help us to assess new technologies in a fast way, and then enable access of new technology to the people. So this is an area which I think is very, very important, especially now when we are moving towards universal health coverage.
With a systemic approach to addressing health technology gaps, the ADP is a unique partnership that brings together a broad range of stakeholders within government, civil society, the private sector, academia and development partners.
So I think there's a whole range of decisions that countries need to make. What we try to do in the Access and Delivery Partnership is to identify some of the key or the strategic interventions that we see might be most helpful to countries.
The ADP is documenting the lessons learned from Ghana, Indonesia and Tanzania and building a knowledge base of best practices so that countries can benefit from one another's experience.
I think what's really exciting in terms of what the partnership is doing is building health technology assessment capacity. So long after the partnership is gone, there will be the capacity in country, in the system, for them to assess technologies and be able to make decisions for what's needed in their particular context.
That's what the Access and Delivery Partnership is all about, getting new medicines, diagnostics and vaccines to the people and communities who need them.